To perform the Thomas test, have the patient sit at the end of the plinth. From this position, the therapist assists the patient into supine. The patient stabilizes the contralateral leg behind the knee. The therapist guides the test leg down to the plinth. In a negative Thomas test, by reaching the plinth, this demonstrates no hip flexor muscle shortening. For a positive Thomas test, the patient's leg does not reach the plinth. The therapist can suspect a muscle shortening of the psoas major or the rectus femoris. If the knee is extended and the leg remains in the same position, the rectus femoris can be ruled out and the psoas major is identified to detect flexion contractures of the hip. By extending the knee, the rectus femoris is put on slack. Therefore, if the leg drops to the plinth, the therapist can determine that tightness was due to the rectus femoris. Therapists should also be aware of secondary muscle tightness and the tensor fascia lata, or the hip adductors. As the leg is lowered, if the tensor fascia lata is tight, a lateral deviation of the leg will be present. If the hip adductors are tight, a medial deviation will be present. These motions should be noted, but the therapist should be guided back towards midline to consider isolating hip flexors. If the tightness is present in the rectus femoris, the knee flexion range of motion can be measured with a goniometer. If the knee flexion is less than 80 degrees, this indicates the degree of muscle shortening.